Welcome to San Ysidro Health's first virtual annual benefits open enrollment period. This year, benefits open enrollment will run from Monday, March 30th through Friday, April 10th. This video will guide you through the steps you must take in order to ensure continuity of your benefit plans for the upcoming plan year. Any changes made through this open enrollment period will take effect on May 1st of 2020 and will remain in effect until April 30th of 2021. Exceptions are only made for qualifying life events. Therefore, please review your options carefully and choose wisely. This year, open enrollment will be passive. What this means is that your current benefit elections, which include medical, dental, and vision plans, will automatically carry over into the next benefit plan year, unless you make a change online in Dayforce during the open enrollment period. You will only need to log into Dayforce and actively participate in online enrollment if you wish to newly enroll in a medical, dental, or vision plan, make a change to your current benefit elections, and add or remove dependents. So, if you don't want to make any changes to your plans or dependents, you do not need to complete this process. Also, if you waived a plan last year, you will not need to waive them again this year. You will only need to waive a plan or plans if this is your first time participating in open enrollment and there are plans you wish to waive. You will have to go into Dayforce and check off the plans you wish to waive if this is your first time. Additionally, keep in mind that if you would like to contribute funds towards a flexible spending account, also called an FSA, you must complete an online enrollment through Dayforce. The FSA entitlement from the previous year will not carry over. So, what's new for this year's open enrollment? Well, we're happy to announce that all the medical plan carriers will remain the same for the May 2020 to 2021 benefit plan year. However, there are a few changes that you should know. What changed? Well, although there was a significant rate increase with the Sharp and SIMSA plans, because San Ysidro Health leadership recognizes this is a difficult time for our employees and your families, San Ysidro Health will not increase your contribution this year and will instead absorb the entire rate increase. As a result, employees' payroll contributions will remain the same as last year. There is also a change you should know with the flexible spending accounts, or FSA plans. The FSA plans provide you with a way to set aside money to pay for eligible out-of-pocket healthcare expenses. When you participate in an FSA, you decide how much money you want to contribute, up to the new IRS limit of $2,750. The money you contribute to the FSA is deducted from your pay before taxes are withheld, which also lowers your annual taxable income. If you wish to enroll in an FSA plan, you must complete an online enrollment in Dayforce. If you enroll in the Sharp Nonstop Wellness Plan, all of your out-of-pocket expenses, deductibles, and co-insurance expenses that are covered by your Sharp plan should be used using the Nonstop Wellness Visa card. Your FSA Visa card should not be used to pay for these expenses. We are also happy to report that there will not be any changes to your dental or vision plans. For additional information on these plans, please refer to pages 23 through 25 in your Benefits Information Guide located on San Ysidro Health's SharePoint. SIMSA Cross-Border HMO is another plan that San Ysidro Health offers to eligible employees. For employees who prefer to receive their healthcare services in Mexico, SIMSA HMO may be the right plan for you. Please keep in mind that you do not need to be a Mexican national in order to enroll in the SIMSA plan. The SIMSA HMO plan provides healthcare services in Mexico with a SIMSA provider. Most services require a small copay at the time you receive your services. The only services covered in the United States are those that are truly emergencies and urgent care visits. Please refer to your benefits guide located on the San Ysidro Health SharePoint for copays and out-of-pocket expenses information. There are several voluntary benefit plans offered through Colonial Life, such as supplemental insurance that includes accident, disability, cancer assist, critical illness, hospital confinement, and term and whole life insurance. To enroll in any of these plans, you must contact the Colonial Call Center at 866-885-9060 or our account representative, Susie Estrada. When you enroll in a voluntary benefit plan or plans, you will pay for them through your payroll deductions. A how-to guide will be provided to you to assist you in enrolling, making changes to your plan, or waiving a plan in Dayforce. But before you start the open enrollment process, please go to your personal information section in Dayforce and review the accuracy of the following information: date of birth, social security number, and address. Verifying this information will ensure there is no disruption with your benefits. Another document you should review before you begin your online benefits enrollment in Dayforce is the Benefits Information Guide located on SharePoint. Please familiarize yourself with the benefits San Ysidro Health offers so you make the right selection that is best for you and your family. If you're adding dependents to any of your plans, gather important information beforehand, such as your dependent's date of birth and social security number. If you will be participating in the FSA plan, determine ahead of time how much money you want to contribute to that account. As mentioned earlier, all open enrollment information is posted on the SharePoint page under Human Resources. Select the Employee Documents icon and then select the Benefits Open Enrollment 2020. It is important you take the time to read through the Comprehensive Benefits Information Guide prior to making your elections. Now, let's talk about the Sharp Health Plan more in depth. As this is open enrollment, we'll use this time to review the Sharp medical benefits, accessing care, and value adds that are available to Sharp Health Plan members. As an enrolled member, you have access to the Performance Network of providers. The Performance Network includes some of our top medical groups, such as Sharp Reese Staley, Sharp Community Medical Group, and Radies. Additionally, you have access to top-performing Sharp hospitals, such as Sharp Memorial and Sharp Mary Burge. Open enrollment is a good time to also remind you that you must select a primary care physician, or PCP, that is contracted with the Performance Network. The PCP will coordinate your care and refer you to specialists, with the exception of women, as you can self-refer for your well woman visits. If you select a PCP but do not feel they're a good fit for you, you can change your PCP and do so once every month. Please contact customer care for assistance with updating your PCP. Also, if you have family members enrolled as dependents on your medical plan, each family member can have a different PCP or medical group. Please ensure that you are accessing the PCP medical group shown on your ID card. If you access someone other than the one you're assigned to, you could be denied services or be responsible for the entire cost of the office visit. One final note, should you need access to urgent care, please make sure you're accessing an urgent care center affiliated with your medical group. You can locate a list of urgent care centers on our website, sharphealthplan.com. There are many ways to access care outside of your PCP. If you have a true medical emergency that is life or limb threatening, please go to the nearest hospital. You'll be covered. If you do not have a medical emergency but would like to be seen, you can call your PCP to find out if they can see you the same day, or you can go to the urgent care or to the emergency department. Another option is the CVS Minute Clinic. Sharp Health Plan partners with CVS as an option for our members to seek services should they need to be seen for a minor illness, injury, skin condition, or other things. CVS Minute Clinic is also a great way to go if you're traveling outside of San Diego County and need to seek services for minor conditions. Please do not use your Nonstop Wellness Visa card to pay for any Minute Clinic services. Also, did you know you have access to Assist America, which is a company we partner with to provide you with assistance should you have a medical emergency and are traveling more than 100 miles outside of San Diego County. Assist America can also provide assistance for medical emergencies when traveling in another country. Now I'm going to give you quick benefits at a glance information. It's important to remember that on the high deductible plans like Sharp is, the deductibles and out-of-pocket maximums renew every calendar year from January 1st to December 31st. There's no copay for preventive care, but all other services such as primary care physicians or specialists, office visits, emergency rooms, inpatient hospitalization, and prescription benefits require you to meet a high deductible first before paying the applicable copays or insurance. However, if you go to the ER and you're admitted to the hospital, the deductible is waived. Although you may see these numbers, these deductibles, the out-of-pocket expenses in this slide, please know that all of these costs are covered through the Nonstop Wellness Plan. That's your Nonstop Visa card, with the exception of an emergency room visit when you don't get admitted. In that case, you'll be responsible to pay $100. Now, we'll talk more in detail later about how the Nonstop Wellness Plan works with the Sharp plan, but in the meantime, I'm going to provide you with a little information that requires some administrative tracking on your part. As with any high deductible plan, it's a good practice to track your expenses that get applied towards the deductible and out-of-pocket maximums. Once you believe you've met the deductible or the out-of-pocket max, contact Sharp Health Plan's customer care team and request an audit of your account. That audit can take up to 60 days for completion. As a reminder, all out-of-pocket expenses and deductibles should be paid by using your Nonstop Wellness Visa card. Sharp Health Plan members have access to a wellness program through Best Health. Through Best Health, you can access personal health coaching at no cost to you. You can access fitness centers, participate in interactive wellness workshops, create meal plans, and access many other programs all through Best Health. The Best Health Wellness program is available as a mobile app for ease and convenience. Quick reminder, you cannot use your Nonstop Wellness Visa card to pay for any of the Best Health Wellness programs, including the weight management program. Once you are enrolled as a Sharp Health Plan member, you can register to access your health insurance information through Sharp Connect, your member portal. Once registered for the portal, you can check your benefits, change your PCP, print or request your member ID card, and view your drug lists and costs. For additional questions on the Sharp plan, please contact the customer care number there on your screen, 800-359-2002. or customer.service@sharp.com. Okay, now let's talk about how the Nonstop plan works with the Sharp Health plan and what you need to know. The Nonstop Wellness program is funded by San Ysidro Health, meaning San Ysidro Health covers the funds on your Nonstop Visa card to pay for your in-network covered deductible copays and insurance costs, pharmacies, wellness visits, all that. San Ysidro Health values you, and we want to make sure you and your families get the care you need to stay happy and healthy. Nonstop Wellness Sharp Health Plan is a benefit that is available to eligible employees and their families. Also, acupuncture and chiropractic services will once again be provided through the Landmark Network. Now, please read through your comprehensive summary of benefits for detailed information about the Landmark program. Earlier, I mentioned that the Sharp Health Plan is a high deductible plan, and you also saw a slide that included deductibles, copays, and out-of-pocket expenses. Any expense that is required using an in-network service is covered, and you should be using your Nonstop Wellness Visa card to pay it. As a reminder, again, if you visit the emergency room and you are not admitted, you will be responsible for paying the $100 copay. And Nonstop Wellness provides a nonstop exchange portal that allows you to access documents. So please refer to the Employee Documents tab in the Nonstop Exchange member portal to access and view all complete plans and summaries from Sharp. Now, all legal and compliance-related notices will also be located under the Employee Docs tab in the NSC. As you can see on this slide, annual deductibles, annual out-of-pocket maxes, office visits, labs, and x-rays, urgent cares outpatient and inpatient surgery, emergency room, and prescription costs are outlined here. With the Nonstop Wellness Plan, your in-network and approved costs are covered, again, with the exception of that emergency room visit. Once again, if you're not admitted to the emergency room, you will have to pay $100 to Nonstop Wellness. However, if it is deemed a true emergency and you are admitted, Nonstop Wellness will waive those costs. Now, let's briefly discuss the Landmark Health Plan. The Sharp Nonstop Wellness Plan includes a chiropractic and acupuncture benefit through Landmark. This plan provides 30 annual combined visits for a $0 copayment. Referrals and authorizations aren't necessary to seek treatment, but be certain you're at a participating Landmark provider for services to be covered. Visit the website address listed on this page to find a Landmark provider near you. So, how do you use Sharp Nonstop Wellness? Well, for those of you who have not used it, this is new information, and for those of you who have, this is a refresher for you. After you enroll in your medical benefits, which includes Sharp Nonstop Wellness Plan, you'll receive a Nonstop Visa card in the mail. You'll use this Nonstop Visa card to pay for in-network carrier-approved charges you incur with the Sharp plan. So, when you go to the doctor, as long as they're in-network for your plan, your Nonstop Visa card can be used to pay for your covered copay, coinsurance, and deductible costs. One thing to remember, be sure to present your Sharp card to the provider first so they can apply any costs towards your deductible and out-of-pocket maximum before paying with your Nonstop Visa card. And here's the key. The Nonstop Visa card can be used for all in-network prescriptions and in-network medical services that you receive, but it cannot be used for services that Sharp does not apply towards your in-network deductible or out-of-pocket maximum, meaning no out-of-network medical costs, no dental costs, and no vision costs. Now, let's dive into some key things to know about Sharp Nonstop Wellness. Let's take a quick moment to review what is not included in the Nonstop Wellness Plan. While you do have dental and vision coverage, it is separate from Sharp Nonstop Wellness. In other words, you cannot use the Nonstop Visa card to pay for dental or vision expenses, nor can you submit claims for those costs. Additionally, the Sharp Nonstop Wellness Plan does not cover any elective procedures, or really anything that is not covered in your underlying Sharp medical plan. Please refer to the summary of benefits for authorized services. Please remember that the Nonstop Visa card can only be used with the current calendar year and that all 2020 claims are due by March 30th of 2021. Also, if you leave San Ysidro Health or are terminated, you have 60 days to submit pending claims. Be sure to submit all claims during that period. And one last important reminder, reimbursement checks from providers or your carrier need to be sent back to Nonstop. Reimbursement checks are most likely sent out because you have double paid a bill, or you were overcharged on a copay, or you paid a bill twice through the portal. Please send any reimbursement checks to 1800 Sutter Street, Suite 730 in Concord, California, 94520. That's 1800 Sutter Street, Suite 730, Concord, California, 94520. Now let's talk about the Sharp and Nonstop member portals. As a member of Sharp Nonstop Wellness, you'll have access to our member portal, the Nonstop Exchange, otherwise known as NSE. NSE includes a user-friendly interface and mobile access, as well as the ability to check available balances and claims processed to date. As you can see from this image, the NSE site will allow you to see your claims and payment details in real time, which will give you insight into how you are using your Nonstop Visa card and how much you have left on it. Once you're enrolled with Nonstop Wellness, NSE can be accessed at members.nonstopwellness.com. Please refer to your benefits guide for details on how to log in. Alternatively, you can contact Human Resources or Nonstop Wellness for support in logging on. In order to submit a claim manually or respond to a substantiation request, you will need a copy of your Sharp Explanation of Benefits, or the EOB. It's easy to find your EOB once you've registered in the Sharp member portal. The Nonstop Wellness team is here for you, so please always give us a call or email us should you have any feedback, questions, or concerns. You can reach Nonstop Wellness by calling 877-626-6057 or email Nonstop Wellness at clientsupport@nonstopwellness.com. Please note that Nonstop Wellness support is available from 6 a.m. to 5 p.m. Pacific Time, Monday through Friday. With that, thank you again, and for any open enrollment questions, please submit your questions by email to benefits@syhealth.org. Additionally, there will be a GoToMeeting link provided, and you'll have an opportunity to ask questions there. Please refer to the open enrollment calendar for your GoToMeeting Q&A session. We understand you may have questions, and we are ready to answer them. We'll be offering several go-to meetings starting Monday, and you'll have an opportunity to ask questions then. Please refer to the open enrollment calendar. If you're at home, you can call in. We are ready to answer your questions. And finally, here is another way to get your questions answered. Please submit your questions by email to benefits@syhealth.org. And thank you so much for your time. We look forward to having another successful open enrollment year.